The US state of Oregon is introducing mental health days for school students. Activists say it's needed to deal with what they call a mental health crisis in schools. Suicide rates in the US are at a 50-year high. In Oregon, suicide deaths are 40% above the national average. The new law will allow students to take up to 5 mental health days in a 3-month period. It's hoped this will help reduce the stigma around mental health. According to the World Health Organization, as many as 800,000 people die by suicide every year. It's a global problem that afflicts countries rich and poor. Lithuania, South Korea and Russia are among those with the highest suicide rates. Well, political psychologist Bart Rossi joins us now by Skype from Naples in Florida to discuss this further. And Dr. Rossi, what exactly would you say a mental health day would achieve?
Well, first off, nice to be with you. And I think this is a good step forward. I really believe that mental health in America should be prioritized. So to answer your question, I think what it would achieve is to prioritize mental health, make it important, and make it something that on a go-forward basis we're gonna prioritize. We're gonna make it happen in terms of treatment for people who have all types of mental health problems, whether it's depression, anxiety, personal conflicts, suicide, or a whole array of issues that confront people every day.
But surely this can't simply exist on its own. It's all very well taking a day off to reset, but if there are underlying concerns, a day off or two isn't going to help much, surely.
Well, again, to prioritize mental health is really the issue here. And if you think about it, people take medical days off because they don't feel well. Sometimes they kind of fudge it, but they take health days. Mental health days are important too. Psychologists have said for a long time, without mental health, there's no health. So I think this is really a positive step in the right direction. I don't think people should take advantage of it, but I would predict that most of the days are going to be reasonably taken, and it's going to be something that works, and it probably is a good thing going forward.
Do you think that this should be made available more widely, so not just for students, but for the wider workforce?
Absolutely. Mental health needs to be prioritized. And if you look at what happened in 2017, where the bills out of the Senate and the House both eliminated mental health in America for most of it. And, McCain and some others, knocked that down. But it could have passed, and it would have effectively eliminated mental health coverage with insurance companies entirely. I mean, that's a step backwards. This is a step forward. And I think it's a good thing because we need to have mental health and what psychologists can do today with cognitive behavioral interventions really at the top, not at the bottom of the healthcare system.
Dr. Rossi, it's great to get your thoughts. Thank you very much indeed for speaking to us here on Al Jazeera.
Nice to be with you.